Thank you very much. It's been an absolute pleasure attending this meeting, working with Steph, with Talana, with Hunter, the whole entire staff. And just as a note before I get started, I don't go to I mentioned this last night when they presented me with that incredible award for Medical Professional of the Year. I don't attend many medical meetings. I really like to learn from reading. When I'm not at meetings and I do have some free time, I like to be home with my wife, my wonderful 11-year-old son. But this, I thought, would be a special meeting, and it's turning out to be an absolutely incredible meeting. From the academic side, the research side, and also from interacting with all of you and the patients. I've called home countless times just sharing the story with my family, or stories with my family of what you've gone through. And I'm coming in at a very fortunate time to this. As you'll hear, I'm only involved with this most recently. But you guys have worked so hard to create the groundwork, to fight the battles, and to get where we are today. And now I just see things moving exponentially forward. So hopefully I can help with that and be part of that. So I'd like to just share a few things. One, how I came to be involved with this topic. I think it's an interesting story. My long-term role in providing free education and the resource that we built for healthcare providers and that we're going to continue with, and also a resource that we will be launching for patients, caregivers, and dispensary staff, so they'll also have access to this material. So just to start off, the title of the talk is Medical Marijuana Establishing an Educational Resource, but it should really be called the following. I don't know the answers to any of our 11-year-old son's medical marijuana questions. So let me be honest and let me explain. So my wife and I are both physicians. We teach residents, we do clinical, we do a lot of variety of different things. And we were discussing medical marijuana at home, and this was back in November of 2012. And we were discussing the proposed regulatory changes in Massachusetts, and our son overheard the discussion. And he came in, and it was perfectly appropriate what we were discussing, and he came in and he had some questions for us. And he said, "Dad," he goes, "what about carbon monoxide?" He goes, that can't be good for you. And these are his actual questions. And he goes, "doesn't smoke produce cancer-causing chemicals?" And he asked, that was another question. And he said, "what if you write a prescription," now we know in Massachusetts it's certification, "and a patient then has a car accident, are you responsible?" And he said, well, every day is like this with my son. It's great. And then he said, "what about secondhand smoke if there are children in the house?" And I turned to him, I said, "Bradley," I said, "these are incredible questions." I said, "and I truly don't know the answers to these questions." I said, "and if I don't know the answers to these questions, and I'm considered a pain expert, think about all those doctors who are further removed from the pain literature who also are not going to know these answers." So what we decided to do is we realized that it could be two extremes of doctors, and this was a major concern. There are going to be doctors who may just say, they won't say it, but they will know nothing about it, and they'll just say, "no, I'm not certifying you, I want nothing to do with this." The other concern I have, there may be doctors, good intentioned, who will say, "yeah, I'll gladly certify you," but then have no way of guiding their patients because they're really not educated in this area. Neither extreme was going to be very good. So we decided that we should really launch an educational initiative in this area. So let me give a little background. So by way of background, in 1998, I co-founded the Answer Page. It's a free educational resource, and I created it just for our residents. I thought it'd be a good resource for our residents because the way things work in the hospital, especially in the operating room environment, is you can have the greatest plans for doing education that day, but with emergencies, lunch breaks, changes in rooms, things like that, before you know it's the end of the day and you didn't really do the teaching that you intended. So with a colleague, we decided, well, what if we created this educational website so that every day the residents and the staff would have something to discuss and something from which to learn. And we launched it, and it went off incredibly well. But then what we found out was Hopkins was linking to us, Stanford, Harvard was linking to us, and it was great, and we're getting incredible thank yous. But what was, I think, most meaningful is we started getting thank yous from around the world. And two, I'm just going to note two that will always stick in my mind. One said, "thank you, we use your website every day," which really resonated with me because the whole key was learn something every day. It says, "we can't afford textbooks, but we use your site every day." Another was from an Indian anesthetist. He said, "thank you, you are helping the developing countries educate themselves. And once I got these responses, I knew we had to keep this going. So we kept this going since 1998. Initially, it was just my colleague and I writing the content. It was like writing a term paper every night. We never missed a day, but on Sundays, we'd be frantically trying to prepare the next week's work. Now it's a little different. Now it's accepted criteria for promotion in academia. We have a really nice large staff, which I'll explain very shortly about running content. And so we've been advancing this effort. So we did a few things also to keep it really interesting. So I had this idea of creating an interactive crossword puzzle. So if you go to this site, and this is going to be optimized later on for iPads and things like that, but right now it works really well on the computer system. We created an interactive crossword to make it a fun way to learn. Because so many nights I'll be on call and the nurses and doctors will be at the computers playing games and they say, you know, I really should be doing my reading, but I really like these games. So I had this idea. So I said, what if you just couple the two and make the crossword the CME activity or the nursing activity? And also you'll notice, unlike other types of crossword puzzles, the questions, the clues are intentionally long. And we did this to reinforce the education. And also if people just jump to the crossword, we really want to get the education across. So that's why the clues are a little bit different. We've now provided well over 100,000 hours of continuing medical education credit. We're rated in about 120 countries, and now we have this international team of expert writers. So in addition to our areas of perioperative medicine, anesthesiology, hospital medicine, clinical statistics, we also do needed areas such as risk management, opioid prescribing, pain management, palliative care, and we also now meet all the requirements for the Department of Public Health's requirements for CME for medical marijuana. So we launched our medical marijuana educational content in January 2013, shortly after the law went into effect in Massachusetts. And then news releases, press releases, and really just positive feedback started pouring in. And then the Massachusetts Medical Society, I'm very pleased to note that Massachusetts Medical Society, the publishers of the New England Journal of Medicine, they're our joint sponsor for all our educational content. And this was exciting given the whole political climate of this topic. And in fact, they've co-branded our opioid abuse series that we wrote, and it's now one of their most popular online courses. And I just want to note that they don't edit, they don't tell us what to write, they're just our joint sponsors, and they've been incredibly supportive of what we've been doing. In fact, what they've done is they've linked to all we are their sole source for education in this area. So they link to us directly for all our educational content. And I'm also pleased to note that they've been asking me to go to all the district society meetings to speak to the doctors and to speak to other healthcare providers about this initiative. So it's very exciting how supportive they've been. Also want to note that we've gotten philanthropic support. We've gotten the ongoing support of Mr. David Kessler of the Massachusetts Alternative and Palliative Care. And the Mass APC is an educational nonprofit focused on educating medical professionals, patients, and the general public on alternative pain and palliative care medicine. So right now, this is our educational content. And I'd like to take this opportunity to just briefly thank some of the people involved. It's definitely a collaborative effort. And so the first content we have provided, the Medical Marijuana Primer Week, was actually written by Paul Amontano of Normal, and they've been incredible. They've been very supportive, everyone's been supplying unbiased quality content. I've been really proud of all the contributions. Medical marijuana laws and agreements have been written in part by Evans and Cutler and Vicente Cederberg. They've been also contributing. We have an excellent chapter on the development and evolution of the cannabis dispensary system by Amanda Ryman, who is here somewhere, I believe, somewhere in the room. Thank you very much. Sunil Agarwal, who many of you probably also know, has been a great resource, has become a friend. He did the chapter on chronic pain and helped with some others. He also put us in contact with a PhD student, Thomas Lee, who did a great chapter on cannabinoid hyperemesis syndrome, which is very important for clinicians to know about, as people may present in the ER with this entity. And if you don't know about it and you miss the diagnosis, it can be a real concern for the patient. I also want to thank Dr. Russo, who's here somewhere in the room. He's provided there he is. He provided me as recently this morning with 2 articles, and he's well referenced on several of our syllabus topics throughout our site. And I just want to mention, our editor-in-chief is actually my wife, and she's been doing a great job with this. Her background is biomedical engineering. She's also an anesthesiologist and doctor. We trained in the same program. And we're just trying to create quality, unbiased education for all those involved. So just moving forward, we have an ongoing collaboration with Mark Ware and many of his colleagues to create ongoing education in this area. These are some of the topics that we'll be addressing, but the syllabus goes on and on. So I don't view this as just meeting a 2-hour CME requirement. This is an ongoing effort. And given the notice I just received, I'm not going to have time to discuss these, but we'll just quickly go through. Instead of reading through them, we address the basics of pharmacology. We discuss, what are cannabinoids, what's the endocannabinoid system, how do they interact with the human body? And you'll see this, you can all register for free on the site and make use of it. We go through physiology. And what I'm also pleased to note is that now in the anesthesia literature, studies like this are coming out. This just came out this last month, where in the premier journals, we are now looking at this, and we are looking at the endocannabinoid system and its relationship to pain and pain modulation. In fact, I'll just quickly read from the beginning of this one study. Well, not so quickly. Just... Okay, this study starts off by noting endocannabinoids regulate multiple physiologic functions by pharmacological actions in a manner similar to marijuana. Recently, much attention has been paid to the analgesic effect of endocannabinoids in terms of identifying new pharmacotherapies for refractory pain management. So I think it's just absolutely great that this is now in the literature that doctors are reading, and this is part of, this will be part of journal discussions, grand rounds, and so forth. We also discussed a lot about pain, the synergistic effect, one is pain perception, how does it modulate pain. So what I'd like to do is I'm going to leave you with, we have a crossword puzzle. And so it's not interactive, but we're going to hand those out. We also have an answer key. And I just thought you might like to use it, have some fun for the weekend. We have, here are the questions. There'll be an answer key also. And feel free to go to this site. We don't use anything with your name. It's all kept confidential. The site is free. As I mentioned, we'll be launching a patient site probably in the next month or so, if all goes as planned. But thank you very much. It's been incredible working with you all. It's been an incredible meeting.